Hello and welcome to another edition of the Mount Nittany Health Virtual Tour. We are taking you behind the scenes at some of the most advanced, high-tech spaces across our health system. Today we're here with Brian Newcomb, MD, Medical Director of Mount Nittany Medical Center's Emergency Department. He's joining us from one of two trauma bays located inside the Emergency Department. Welcome, Dr. Newcomb. We're going to begin by asking you to remove your mask so that everyone can hear and see you throughout our video today. So for those watching at home, we are practicing physical distancing in this space at this time. Normally, Dr. Newcomb would be masked, but for the purposes of this video, we're going to go ahead and remove his mask again so that you can hear him. Thank you. Dr. Newcomb, tell us more about what you do here at Mount Nittany Health.
Hi, I'm excited to be here and talk about the emergency department. As Leanne mentioned, I am the medical director of the Mount Nittany Medical Center Emergency Department. In my role as medical director, I work with the patients as well as the staff to ensure we provide excellent emergency department care 24 hours a day, 7 days a week, 365 days a year. Whether it's nights, weekends, or holidays, we're here and we're ready to take care of you regardless of what time you show up. I have been practicing emergency medicine at Mount Nittany for over 20 years now, and I am board certified in emergency medicine.
Okay, very good. Thank you, Dr. Newcomb. Can you tell us more about the services that are provided in the space that we're visiting here today?
Sure. Today I am in one of our trauma rooms, or our major resuscitation rooms. So we use this for our most critically ill or sickest patients, whether it's a trauma patient from a major car accident or a fall, or even for patients that are non-traumatic, such as heart attacks, strokes, patients that are having respiratory difficulty or unstable vital signs. The idea is the resuscitation can start immediately when they come in this room. We actually have a separate door for the paramedics to bring the patient in directly and bypass triage. They call ahead of time, so we're ready to receive the patient when they get here and immediately start life-saving care.
Very good, thank you. What type of technology or special features can you show us here today?
Sure. So as you can see behind me, we have lots of equipment in this room and technology. We have monitors that help us monitor the patient's vital signs and help with the resuscitative efforts. The room is actually designed that everything's very flexible. That whole monitor bank there can be moved, and we can actually double the room up in a mass casualty situation. The overhead lights move as well. So fortunately, that situation doesn't happen very often, but we're prepared if it does. Also, behind me, we have multiple carts and cabinets full of resuscitative medications and equipment. These would include equipment such as cardiac medications, and if we need to put an endotracheal tube or intubate somebody where they're not breathing on their own, we can do that and provide other life-saving care. We have basically everything at our fingertips to provide immediate emergent care for the critically ill patients.
And it sounds like, based on the patients that come in here that you were describing, in most of those cases, time loss could be brain loss or
Correct.
Could be damage to a heart muscle. So for the heart attack patients and the stroke patients, you see this room is quite a life-saving feature in the ED.
Correct.
Okay, great. Are there any other special features about the emergency department that you'd like to show us or tell us about today?
Sure. So we are fortunate that we have a brand new facility as of 2012. The entire emergency department was rebuilt. It's brand new construction, and in doing so, we have new technology, and we have increased number of room capacity significantly. Also, in the redesign of the emergency department, besides having technology which helps take care of the patients, they took into account patient privacy as well as comfort measures for the patient as well as their family and loved ones. So we know it's difficult anytime you have to come to the emergency department, but we've tried to create a situation where it minimizes the stress as you're already stressed about your illness.
Can you tell us a little bit about the redesign of the ED? As you walk through the ED, you see different pods
Sure.
labeled. Can you tell us a little bit about how that works?
Sure. So when they rebuilt the emergency department, there's a central hub, and then we have 4 pods, which are essentially mini emergency departments. Each pod has its own nurses station as well as waiting room, and this enables us to be efficient and open or close pods as necessary. For example, in the morning, early morning, we tend not to be as busy, and as we get in the later morning or early afternoon, volume picks up and we can open the pods up. Similarly at night, when in the middle of the night, we tend to not be as busy and we can close pods down to be as most efficient as we can.
Mm-hmm. Great, thank you. Is there anything new happening in the emergency department that you'd like to talk to us about today while we have you here?
Sure. One thing I'm extremely excited about is we have an ED telehealth platform now, where we can provide emergency virtual visits 24 hours a day, 7 days a week, 365. This is something new that came out of the whole COVID situation where people wanted to do telehealth, and we responded by developing this platform. Obviously, being a telehealth service, it's designed more for the urgent care or minor emergencies. So if you're having an acute life or limb-threatening scenario, such as a heart attack or stroke, please call 911 or come see us rather than use the telehealth. But for a lot of the stuff we see, we find that patients are very happy with doing a telehealth visit. We've also recently got set up so we can actually order COVID testing from the telehealth platform if deemed necessary. We can actually put the order in the computer and the patient can call central scheduling and get scheduled at our outpatient drive-through testing sites to get COVID testing if that's part of the treatment plan. So we're very excited about the telehealth platform and encourage people to check it out.
That's great. And for those watching, you can get started with an ED telehealth visit simply by going to mountnittany.org and clicking on ED telehealth visit.
Yes, can I add one thing on that?
Absolutely.
So so you click through mountnittany.org and it actually takes you through the registration process as if you were an in-person patient. They actually put you on a tracker like you were a patient, and then they get one of the providers to come see you. We go to a private, confidential, designated room where we perform the telehealth visit. So it's in a lot of ways it's similar to being here.
Right, great. Thank you for taking us behind the scenes there for a little bit, Dr. Newcomb. I'm wondering, are there any health or wellness tips that you'd like to share with our viewers while we have you here today? Anything you'd like to remind us?
Sure. I mean, in light of COVID, I think we need to remind people with that we all have to do our part to get through this. We have to protect ourselves, our families, our neighbors, our community. If everyone does their part, it'll help minimize the effects of COVID. This would include wearing a mask, social distancing, washing your hands, and also if you're sick or you have COVID or you were tested for COVID and you're pending the results, please stay home and stay away from others until you're cleared to participate at work and be back to your normal activities. So we gotta look out for each other during this scenario.
Yeah, that's great. Thank you. Before we let you go, we do have a few questions we received from our viewers. So we're hoping you can help us with those. The first question is this: in an emergency or urgent situation, how do you know when you should drive to the hospital versus when you should call an ambulance?
Sure, that's a great question. So in general, if you're having anything that could be life or limb threatening, I would call 911. It's a broad topic, but if you're having chest pain, if you're having stroke-like symptoms such as numbness or weakness, call 911, shortness of breath. And there's several reasons. The first is when the paramedics arrive, they can actually start medical care and treatment in the field. For example, they can put an IV in, they can give you certain medications, they can give you breathing treatments, and in the most dire situations, such as cardiac arrest, they can do CPR. And the second reason is they communicate with us, so we can expedite your care and get things ready for when you arrive. This is particularly important for a couple scenarios such as heart attack. So if you're having chest pain, the paramedics in the field can do an EKG where they hook up leads to your chest and they can transmit an EKG, electrical trace into the heart, and we can look at it in the emergency department ahead of your visit and say, wow, this looks like a heart attack, let's get the cardiac cath team activated. And when you're having a heart attack, you have a blockage in one of your arteries, and the treatment is to get the blockage open as soon as possible. They always say time is muscle, so the quicker it's open, the better you'll do. So in that scenario, we can call the cath team ahead of time and get the care expedited and quicker to definitive care. Similarly with stroke, we have a similar scenario. If you're having stroke-like symptoms such as numbness, weakness, difficulty speaking or walking or dizziness, the paramedics call ahead of time and we call a stroke alert. That mobilizes our resources, and when you come in, they take you straight to our CAT scanner, so we take a picture of your brain. When you come back, we can provide immediate care, and certain things we do with stroke, such as some of the medications as well as the interventions, are time limited. So again, the faster we do that, the better. So if we know ahead of time, we can give more timely care.
Great, that's a great answer. Thank you so much. Next question is this: how are we prepared for Penn State students returning in the fall?
Okay, we always look forward to the students returning. Fall is a busy time for us with the students in football and all the things that go on. I guess nobody knows for sure what's going to happen this year with COVID and the students, but we're looking at all the scenarios and trying to be prepared for all of them. We have had discussions with the student health clinic to make sure we're on the same page with algorithms and follow-up. We also upstaff in the fall typically as we're busy anyways. And last but certainly not least, when COVID first hit locally in March or April, it was new for us. It was new for our nation, and we weren't quite sure what we were dealing with, and we did a lot of planning in the emergency department as well as at Mount Nittany, inventories to make sure we're ready for a surge of disaster. Unfortunately, we didn't have that surge that we were expecting the way that some places like New York City did, but it enabled us to be prepared for it. So we had a lot of planning done ahead of time now, and hopefully we don't see a surge in the fall, but we're much more prepared than we were back in March. And we've treated COVID now, and we're used to seeing it as well.
Great, that's great. Thank you. Next question is this: what one emergency skill would you suggest that everyone learn if you had to give that advice?
Well, I mean, I think CPR is obvious. That can be life-saving. It's easy to take a class, and in fact, when you take some of these classes, they actually teach you how to use a defibrillator too. AEDs, or automated external defibrillators, are present just about everywhere now, schools, churches, malls, and those can be life-saving as well. So that's a good skill you can take. Additionally, there's a class called Stop the Bleed, which has taught classes locally, which it teaches people outside of the medical field how to put tourniquets on. And that can be helpful as well in a traumatic or even like a mass casualty situation. So if people want to, non-medical providers want to take these type classes, they can really help save lives.
Great, that's awesome, thank you. And then the last question we have for you is, how can you stay calm in an emergency situation? Do you have any tips for us?
Sure, well, in medical school they always say check your pulse first, which basically means make sure you're calm, and then you can focus on the patient as well. I think another tip would be, if you find yourself in a medical situation, it helps to have help and reinforcement. So if you're trying to treat somebody or get things started, if you have somebody else that can go get help, or if you can call 911 so you can get somebody with more expertise and more definitive care to help you, that's always paramount as well.
Okay, great. Well, that's about all the time we have for today. Thank you, Dr. Newcomb, for being here with us today, and thank you to our viewers for watching. Please be sure to follow our Facebook page for our next virtual tour stop. And for more information about the services we visited today, please visit mountnittany.org.